Good afternoon. I'm Westchester County Executive George Latimer. It is Friday, April 3rd, and this is our Westchester County coronavirus update for today. We have online various members of the press. They will be submitting questions to Catherine Chaffee, our Director of Communications, who's the host for this teleconference, and we'll try to address those questions at the end of our prepared remarks. I want to begin today on a very sad note. I want to talk about the life of a gentleman who I've known over the years as an elected official and an active member of the Eastchester and Bronxville community, Glenn Bolito. Glenn has served as an Eastchester Town Councilman since 2011. Prior to that, he was active in the Village of Bronxville government as a village trustee, deputy mayor of the Village of Bronxville, served on the Bronxville Zoning Board prior to that. By profession, he was a financial professional in both the private and the not-for-profit sectors. He's a graduate of Harvard with a BA and an MBA from that institution, a graduate of Stepanek High School. His wife, Kale, and two children, Dale and Gage, part of the family, the Bolito family. They had a terrible tragedy less than 2 years ago when their son, Gage, died at age 19. Tragedy has visited the Bolito family now once again. We lost Glenn Bolito to COVID-19 the other day. He's active in the community, Orders of the Sons of Italy, the Lions Club, Italian American Citizens Club, a tremendously wonderful person to know. We were in different political parties. We had some disagreements and we had some agreements over the years, but I always found him to be a community-minded, a community-spirited person. This is just one of the many faces of what the COVID-19 virus means. It is invisible, it is nowhere, and it's everywhere at the same time. It's changed our lives, it's affected our economics. We'll talk about our economics, we'll talk about what the impacts are statistically. But every one of those statistics, as we all know, is a human being with a family and a life, and that life has been cut short. We're going to miss Glenn Bolito, and we're going to miss the other individuals that we've lost to this. And if this were the end of the losing, we would try to come to grips with it. But we're far from that point right now. We don't know just how far this situation is going to advance. We've talked about, heard discussed about the apex and the surge yet to come. And we know that as it does go forward, we will have more stories of more people like Glenn Bolito, friends and people who've contributed to this county. We extend our condolences to Kyle and the family and to the family of Bronxville and Eastchester on his loss and the loss of all of those that have died. And we hope that somehow these actions that we take will, if not stop anyone else from dying, we'll at least reduce it. That is really what this is all about. This is not so that we can have showtime and visit with you half an hour every day or an hour every day. This is not to try to transfix you with stories of statistics or what we're trying to do to manage this government of ours. We're trying to save lives. And in this particular case, we lost a life. We have information on the number of cases that the governor makes available to all of us, but we have not gotten the breakdown that I usually like to share with you at this time. As I've mentioned off and on over a couple of days, we've suspended giving numbers and then we reestablished them because of the large number of unknown cases that we have, 2/3 of the caseload when I reported yesterday, and we don't even have the breakdown today by community. We will prepare that when we have them, and we'll share that with the media so that you have the community by community breakdown. I suspect it will show growing numbers, frightfully growing most likely. We'll see that the largest communities in Westchester County, Yonkers, New Rochelle, Greenburgh, Mount Vernon, White Plains, are continuing to see these cases rise because of the total population, also because of the density of the population. Some of our smaller communities are densely populated, and places like Portchester and Ossining Village are scoring high as well in cases and in some cases fatalities. We do know that there are 418 Westchester residents currently hospitalized for COVID. Out of the total cases of 12,351, which was reported today by the governor, that represents slightly under 3.5% of all those who have cases. And in point of fact, if you take the aggregate number of cases that was presented today, 12,351, and you subtract out the nearly 1,100 cases that were there 2 weeks ago, those 2 weeks have passed. Those individuals, if they haven't died, if they're not hospitalized, are determined to be now COVID-free. And with that, we have a net number of active cases of 11,260. That's not a big difference from the total number, but that number will rise with each passing week. a hospitalization number of 418 at a percentage of 3.5% is considered a good percentage number. We have feared that we would have as many as 20% of all of our COVID positives potentially hospitalized at any one point in time, and that is the surge. When you have 15, 17, 20% of all of the active cases and a large number, when they are hospitalized and they are fighting for their lives, that is when we're at the greatest jeopardy. We have reported at this point 71 deaths due to COVID-related diseases, directly through COVID or related diseases. We do not have a breakdown by municipality. There are people who pass away, are residents of a community, and they pass away in a different geographical area, maybe in New York City, maybe across the state line. But the stories of the individuals are still just as profound. We will try, as we have tried heretofore, to get more accurate numbers to share so that the public understands what we're facing. But I think we understand what we're facing. It was just a month ago, this day, on the 3rd day of March, that we acknowledged that we had our first case of COVID infection. That individual, the index patient as he's been referred to, has subsequently gone home. He was on life-saving ventilators for quite a while, but he was young enough and healthy enough to rally. And now we see him now recuperating for the rest of the way at home with his family. And that is the success story. That is what we have to try to have in as many of these other situations are success stories. To that end, just one small part of our update, Westchester County Center, a county facility, has been turned over to the state of New York to operate as a additional hospital in the mix of hospitals. We're estimating it may take yet another couple of weeks before the hospital is open and usable. We believe it's going to tie into the overall inventory of hospitals, perhaps more directly monitored through White Plains Hospital, which is nearby, and that will be available to handle COVID patients if it is so deemed through the state health department. They are looking at all hospital beds throughout the New York State, New York metropolitan area, and making decisions about what is the best way to allocate those who are sick. There are people who will be hospitalized to give birth, to deal with other illnesses, and all of that will be organized in a fashion so as to keep non-COVID patients safe from the infection expanding into their situation as well. Westchester has totally tested now over 40,000 people for COVID. The number of positives are 12,000. The number of negatives, therefore, are 28,000. We're still running better than a 2-to-1 ratio of people that have tested negative rather than positive. But the number of positives are still significant enough to give us cause to worry. Our bed total of hospital beds is still sufficient to handle that portion of the contagion that comes from Westchester County. But in the coming days, we expect that number is going to rise. And as I've said a number of times before, there is no wall around Westchester County. If we have an available bed and we've satisfied all of the people who need it here, then that bed is going to be made available for somebody who may be ill elsewhere. And that's an important element as well. We have taken some action in terms of the economic development needs that we have. We recognize that we have functionally shut down the society, not fully, but in terms of business, all of the different businesses that are now closed, schools are closed, economic activity is dwindling down. It's affecting the economics of individuals, the economics of businesses, as well as the economics of not-for-profits, religious organizations, governments, and so forth. But our County Office of Economic Development, led by Bridget Gibbons, is now soliciting volunteers to help applicants, which would be primarily small business people, complete the applications that are coming out from the Small Business Administration, SBA, Economic Injury Disaster Loan Advance Program, and the SBA Economic Injury Disaster Loan Program, and then for individuals, the Paycheck Protection Program. All of these have developed out of the recent legislation that was done in Washington, D.C., passed about 10 days ago. Volunteers can email the words economic development at westchestergov.com to indicate their willingness to help. We are reaching out to individuals in our Element 46 program, which is already existing, an incubator program to identify other individuals that could volunteer to help. All of these volunteers will be trained on all aspects of the application process. And then once that training is done in coordination with the SBA and Community Capital, then they will be able to assist small businesses in applying for these things. The individuals who are suffering by loss of their business revenues will not be left alone. We will be there to try to help them, get them through the regulatory process to the best of our ability, utilizing those who experience in these matters. That is just one step of what we intend to do. We're looking at other strategies, some that involve resources that we have through the IDA, where we've asked for some waiver to be able to use that money creatively for loans for suffering businesses as well. We recognize we are not going to turn around our economic problems until we turn around the healthcare issue. There is no way to do one before we do the other. But we are concerned now that we start to put people in a position where they can address these issues and do it in an effective time frame. We continue to mention that our county parks continue to be open, but they continue to be monitored on a regular basis to make sure that social distancing is under effect. It's a rainy day today, so we don't expect to get the same turnout that we would get otherwise, but we have 5 park patrols until 6 in the evening that to our various parks to make sure that the social distancing, out myself to look at those instances at our golf courses, at our nature centers, our hiking trails, and our large open areas like Kensico Dam Plaza to make sure that social distancing is in effect. And that is critical in everything we do. It is still open to go to a grocery store, a supermarket. It is still available to use certain types of businesses that have not been shut down because they still provide an essential service. But even with the essential service and maintaining the business being open, we have to show social distancing, and we're going to try to enforce that in every way possible. We think it's timely to stop and send out an important thank you to a group of people that have really done an exemplary job for the month plus that this has been underway. The county government first started to talk about the concerns of coronavirus in the last week of January. We were not sleeping at the switch. We were moving in a number of directions with our Department of Health and elsewhere to try to address this contagion. But we have seen exemplary work being done by our traditionally who we call our first responders, which are fire departments, our emergency services departments, volunteer ambulance corps, EMS in general, we call that, and our police departments. They are there every day providing a service out on the streets of this community, and we thank them for their service. But we have to add to it the healthcare workers and the healthcare professionals, because in this war, it is not a military person that is on the front lines taking a bullet. It's a healthcare worker on the front lines exposing themselves to the contagion and potentially exposing their family at home when they go home at night. These people are working double shifts. They're working past the point of normal fatigue. They're using skills that they developed over time, but they have to do it in almost instantaneous level of decision-making where people's health and potentially life and death are at stake. And it's only going to get worse. It's only going to be more intense. We're only going to see more people begin to be hospitalized, and unfortunately more people suffer fatality because of this. So we owe a debt of gratitude to our police, our fire, EMS, and our healthcare workers. We want to state that publicly. Next week, we're going to make some efforts to recognize them more formally. We think that's appropriate and worthwhile. We hope you do too. And if you're home watching this or doing anything and you have free time on your hands and you know somebody who's in one of these situations, please reach out to them. Please say thank you. Pick up the phone and call them and let them know how much you appreciate what they're doing. When we finish this program in a few minutes, you will see on Facebook Live an interview that I had previously this week with Tom Kleiner, who is the head of our Workforce Development Board. It's a 2-county Westchester Putnam board, and we'll talk a little bit more about some of the economic development issues as relates to employment, or in this case, unemployment, knowing that the state is responsible for unemployment benefits, but the county is trying very hard to identify ways to put some of the workforce back to work where possible through a variety of either short-term or longer-term opportunities that may still exist out in the job market. With those provisos, we'll go to questions, try to answer them thoroughly, and then allow you to get on your way. Catherine, any questions from our friends in the press?
Yes, we have one question from News 12. They want to know, considering that the Beeline bus system is running on a Saturday calendar, or Saturday schedule, excuse me, if the buses become too overcrowded, will more buses be added?
Well, we will add more buses, that the volume is overcrowding. But unfortunately, what we're seeing is that the bus volume has dropped, dramatically. And it's dropped dramatically because so many businesses that are deemed not essential have closed. When bars and restaurants have closed, many of the hourly workers that work in places like that use mass transit to get to work. There are people who do jobs cleaning office buildings, cleaning hotels. Well, the hotel market now is pretty close to shutdown as it stands now, and many of the offices are empty. So many of those companies have cut back on their employees. So we're seeing less people who are riding the buses. More often than not, the people that ride our public buses are folks who are less well off. And many of those people have been hit hardest by this by this business change. So we will add additional buses. We may have the flexibility to put an articulated bus, which is the double length bus, on a route that otherwise would not have that if we think the demand is greater given the reduced amount of service. But I think what we're seeing now is appropriate social spacing, social distancing on the buses because the ridership is as low as it is. Any other questions that we should answer?
No, that is the one question we have for this afternoon.
Okay, very good. We will resume these reports on Monday. Over the weekend, if we have anything that's urgent to report, we will try to do that. For our friends in the press who are here, if they have any questions, we can certainly talk in a different context. We'll be happy to share that information and go forward in the challenges we have ahead of us. We are still moving through a very difficult time. It's going to require a wellspring of confidence and a wellspring of stamina for us to get through it. I have the confidence that we can get through it. I don't think we need to have a dog and pony show about it. I think we just have to understand that those of us who are adults, that this is a test for our generation. We intend to pass the test, but we'll pass it by the discipline that we show in our behavior and, frankly, the way that we treat each other. This is a moment at which the desire to operate on an individual basis, our nation has great personal freedom. We pride ourselves on our personal freedom. But this is a point where public responsibility now has come into play as a necessity. We are our brother's keeper in terms of trying not to spread this contagion. We are our brother's keepers in trying to be a little kinder and a little more thoughtful about the other folks we live around, because now we realize that this virus knows no boundaries, knows no geographic boundaries, knows no demographic boundaries. It will attack women, men. It will attack people of all ethnic backgrounds. It'll attack them of all ages. And in this regard, we are truly in this together. I'm George Latimer, Westchester County Executive. Thanks for tuning in. We'll try to have some more important information for you when we meet again on Monday at 2 o'clock. In the meantime, stay safe.